Hi, I'm Dr. Tait, functional medicine and regenerative medicine specialist here in Tucson, Arizona. And today I'm going to really dive into why. Why did I start this practice? Why do I do the things I do in this practice so differently than much of how I was trained over 15 plus years? Well, the short story of that is really twofold. Back in 2012, I had a significant injury myself, and I'm not going to share the entire long form version, but let's just say in the past I had a couple of injuries, treated very conventionally, and periodically over my lifetime, from my 20s forward, I would have these recurrent issues that would rear their ugly head time and again, and I would have to reorder the steps, get things back on track so that I could be my best, both in my personal life and professionally. But I had a pretty good setback in 2012, and it really set me out on a much different journey than where I had been orienting to for the last many years of my professional training. So I went through a residency in physical medicine and rehabilitation or physiatry. I did a pain fellowship, I did a sports fellowship, and I got out into practice and I was working in a very conventional integrated model of care. So again, very important there. We're integrating a lot of steps, but they were very conventional. Right? We were putting together pain management, and again, I don't like that term management because it just says we're managing this while, I don't know, we just wait out our time and have the body degenerate even further. But we're integrating other steps, right? We're using the mindset, which is very important in our process here that we use, our ProMen process, to get people oriented in the right mindset so they can take back control of their health, because I firmly believe you, the patient, dictate your health journey and where it goes, right? So you can direct the outcome. You can take control of certain steps in your life to position yourself to have better health that continues to support you over your lifetime, rather than fall apart and degenerate, as we're seeing so many Americans do, and it's really sad to see that. So go back in time a few years to 2012, I had this injury, trying to recover from it, doing the conventional treatments in this integrated model. I was getting injections, I was getting medications, and ultimately I started feeling like maybe many of my patients do, where I was just sluggish in my thinking, probably some side effects of these medications, and I ultimately didn't like the way I felt, and they weren't really helping me recover from pain. They weren't helping me recover function that I had lost due to this injury. So I started diving deeper into what are the things that I can take control of. I already had a great understanding of nutrition, but how can I take that to a whole other level to figure out things that, again, I was, as a physician, even not doing correctly, right? What things were maybe inflaming my body, keeping me from repairing my body, and putting me on a much slower pathway to recovering my health this time around than maybe in the prior injuries over the years. And so that really drove me to write a book about it. It started as a handout, but it really expanded into a couple 100-page book, The Pain-Free Diet. And you can find that on our website. We'll put a link in the video below if you're interested. But what I started, that was like the infancy of this framework here, and it really dove into this process of how do we get the body in a less inflammatory state? How do we shift it into this reparative and regenerative state that so many people just struggle to find? So as I started tinkering with my own nutrition and diet and taking certain foods out of my diet and incorporating, more importantly, other types of foods that could support healing, well, guess what? The body started to repair, and the pace of that recovery hastened over time. And what do you know? It works when you put the right steps in place. But even at that point, I didn't understand how all these things integrated, and that took me down this pathway in functional medicine. And I've spent hundreds of hours over the past few years learning from tremendous mentors and coaches and training certification programs to take this to a deeper level, to look at all these variables that often are just completely overlooked in a conventional model. And again, operating in a great integrative model as we were, we weren't really recognizing these things. We weren't testing them, so how could we possibly figure them out? And they may be the very reason why this person's operating from a place of feeling like there's something really wrong with them, but they can't get the answers. And so this really culminated as I started to acquire this knowledge. I saw a patient and he was struggling bad. He was on multiple medications for blood pressure. He had prior heart attack. He had a spine surgery. He had degenerative joints. And I really started to present this stuff to him that I was learning, right, and implementing myself. And I said, you know, just follow this, trust me on it. We're going to try to simplify this, make it easy to follow and implement. And that's what we did. We started to break apart the essential nutrition for him. We got him moving again and got him activated with a physical therapist and then a trainer. In a matter of months, he was dropping weight, he was dropping medications to the point where his blood pressure was bottoming him out, and his doctor didn't even want to take him off the medication, right? So we had to almost convince him to take him off these medications he had been on for years, because they couldn't quite understand how he had done so well. And all we really did is put the fundamentals back in place, right? We got his nutrition dialed in. We got his movement dialed in. We got his sleep dialed in. We got his mindset in the right place about taking some ownership again for his health and take back that control that he had lost, because it was such a huge thing to be beat up in this healthcare system, acquire all these medications, feel lousy on them, and go in for appointments but get nothing, none of the tools, none of the strategies he needed to take his health back and then take it to the next level where he wanted to be. And so that was really patient one. And he did remarkably over the next 6 months and continue to optimize his health. Would I say it's perfect? No, just like my own health. We all have our own health journey. But the more we can orient ourselves to those steps that we can take incrementally, day after day, and be consistent with them, the more we give our body this opportunity to operate at a state of better health. And so, you know, why did I get to where I am today? Well, ultimately, I started out on that journey in this other practice and built my own practice because I wanted to do this model full time. I wanted to integrate those steps. I didn't want to mask symptoms. I didn't want to put people on opioid medications, and so many people are on, and so many side effects with them. We can't turn on the news and not hear about them because that's a very one-dimensional model to treat pain. And we can see the failure of that right in front of us now for years of doing that. And it's not the patient's fault, right? These are, you know, kind of the standard treatment. You have pain, we'll give you pain medication. You hurt more, we'll give you stronger pain medication. You have other symptoms, we'll give you more medication for that. So that's the conventional model that really operates now in this chronic disease model of care, where we're just managing a lot of problems for these individuals, but not giving them tools, not giving them strategies, not giving really the education and a framework to operate from that they can take their health back. So, you know, when people ask me, why did I do this? It sounds pretty crazy, right? Going off on my own, taking a completely different path. But just like up this mountain, the path's going to be individual. People have walked there before you, but you're not going to walk in the exact same footsteps they did. It's going to be really individual, and your journey is going to be very personal. But I feel at this state, where we're at as a healthcare system, we are struggling. Many people say it's failing, and I think that's fair. It's failing many people in their ability to achieve the outcome they want for their health. And I just felt there was a time and a place to shift and evolve medicine to where it needs to be, right? Give the control back to the patient, and allow them to decide where the journey goes over time. So, you know, that's really the why. That's why I do this every day. That's why I love coming into this practice and seeing patients and walking them through this framework, because I know the outcomes we're achieving are far superior than a management model, a symptom-based treatment model, if we can call it that. If we can get the systems right in the body and the patient gets their mindset right and takes back control through some very simple steps, right? Habits, nutrition, mindset, that's the formula. Thanks for watching again this video. Check out some of our other videos on the channel, and I look forward to seeing you in the office as a patient, to help you on your health journey, walk from where you may be sitting around at base camp and walk you right up the mountain to that summit where you want to be. Thanks again for watching. This is Dr. Tait, functional medicine and regenerative medicine expert here in Tucson, Arizona.